knee joint is made of 3 compartments: the inside, the outside, and the front of the knee. And any of those 3 compartments can be affected in isolation with arthritis. And if that is the case, then your knee will be suitable for a partial knee replacement. The procedure involves a small cut on the front of your knee where we gain access into the joint. We then remove the worn out parts of the joint and replace them with 2 metal components and a plastic insert in between the 2 to allow movement. There is a risk that you may continue to have pain and stiffness in your knee, and that is a two-way thing. The surgeon has to do their bit right, but the patient also has to do their bit after surgery by following the appropriate physiotherapy advice to get their joint moving straight away to get the best result. Eventually, the expectation is that your knee will function as it did prior to it having arthritis.